Hello, everybody, and thank you for joining us back here at Soligenix's channel. We have another special guest for you guys. We sit here with Dr. Neal Bhatia, the head of Soligenix's medical advisory board for their psoriasis program. Today, we're going to talk a little bit about what he's up to and introduce him. So, Doctor, how are you doing today, and are you ready to get into it?
Good, Michael. Thank you. And thanks for having me. It's an honor.
Perfect. So, yeah, no problem. But what I really want to know first is from your perspective, almost everybody's heard about or unfortunately knows someone afflicted with psoriasis. But from your definition, can you give people a little bit of a summary of what it really is?
Yeah, I mean, psoriasis is one of the most common dermatologic conditions we see, obviously, in the clinic as well as in clinical trials. There's a lot of things coming in the pipeline, which is great. Psoriasis is, in a nutshell, basically a combination of inflammation and turnover of the top layers of the skin, all wrapped into one process. And if you look at the immunological basis for psoriasis, there are many different proteins and cytokines and cells involved. There are a lot of different pathways that contribute to the way the skin turns itself over. Mm-hmm. For patients, the way it manifests is with thickened plaques, mainly on the elbows and the knees to start. Sometimes it can be in the scalp, sometimes in the fingernails. It can involve different surface areas or even extensive surface areas. Mm-hmm. Psoriasis is very itchy. It can be very disfiguring to some as far as the way they see their skin. Even more so, it's just a very uncomfortable condition that fortunately we have some options topically, systemically, and now with the Soligenix platform, we have a way of using it with light and photodynamic therapy, which is very exciting.
Perfect, doctor. You had mentioned this is something you deal with frequently. Tell us a bit more about your profession and like your specialties.
Well, my background is in immunology. I got started in dermatology back in 1995 in training. I've been in practice since 98. My current job, I've been in since 2014, mainly doing research as well as seeing patients in San Diego at Therapeutics Clinical Research. It's been a fun place to be. And we got involved with Soligenix a couple of years ago in the cutaneous T-cell lymphoma trials. Since then, again, I've had the luck of working with Dr. Bhatia, but even more so, our background is basically seeing drugs come from start to finish. Mm-hmm. We've been involved with, again, very early phase proof of concept trials all the way to phase 4s. So working in clinical research has been very exciting to see things come to development.
Yeah, it makes sense. And so you had mentioned that you really enjoy working with Soligenix here. So what is it really about this, the fact that you're the head of their medical advisory board here for the psoriasis program, that really excites you?
Well, I'll be totally honest with you. Dr. Bhatia came to me and said, give us some names of people who are good to work with, as well as some experts in the field. And fortunately, I've got some good connections around. So I picked a couple of people who I know would be good investigators, people who are experts in psoriasis pathogenesis as well as treatment, but also some good dermatologists who are experts in the field that are easy to work with and can help see things grow to the next step. So part of advice, I always laugh a little bit, is telling a company not only what to do, but also what not to do. Mm-hmm. Working in, the big picture of where are things going, maybe turning left when you should turn right, and also just kind of, looking in terms of, what is the market going to bring, not just, tomorrow, but in the next few years. And I think part of it being an advisor is, again, just, doing what's best for the company's best interests.
Yeah, that makes sense. And also, there's a clinical trial that's slated to start like this year, and you are titled the lead principal investigator on this study. Can you define what that means and why this clinical trial is going to be so meaningful?
Oh, well, again, it's flattering to have these nice titles, but in the end, it's about being responsible for good outcomes also. And I hope we can do our best to not only serve the company but serve the purpose of the trial. In the end, the patients who don't have access to treatment or who have tried and failed topicals or systemic agents and really are in need of something not just different, but I think effective for them will probably do well. I think also you find patients who have really good plaques that, again, would do well from start to finish. And one of those things we talk about in research is with patients is if I were treating you, I could do things today, but in the real world, in research, we need you at your worst to get you to your best. And that's one of the mantras we try to stick with, so patients are encouraged to stick with the program and go from there. So in the end, I mean, many good trial sites in the United States and Canada that can get involved with a lot of these trials that have really good dermatologists at the wheel. I think it's a good time for the study to launch. So things should go pretty well.
Awesome. Yeah, glad to hear it. And we had talked about on this channel high bright phototherapy with visible light with CTCL pretty extensively, but we haven't talked about the psoriasis side too much. Can you explore a little bit more with us about why it's such an exciting option for psoriasis?
Yeah. Well, if you look under the hood of cutaneous T-cell lymphoma, there are many factors that are actually very parallel to psoriasis. There's a bunch of different cytokines that are in motion, different cell lines. CTCL often starts as a very non-specific dermatitis that eventually shows itself as lymphoma, but can often be either diagnosed or treated as psoriasis in many different ways. And some of the crossover treatments, like again, some of the topicals, and again the phototherapy options, tend to lend themselves to both conditions.
Mhm.
So I look at psoriasis as really, in some ways, an extension of what we're going to be gaining from what we learned in the lymphoma trials, and I think even more so the hypericin and the light, they'll lend themselves well to the treatment. So I'm looking forward to seeing how things will pan out.
Awesome, Doctor. Well, I really appreciate you taking the time today to help us glean some insight from you. Thank you, everybody, for watching. If you have any questions, don't be afraid to send them over. For now, Doctor, thank you so much and have a wonderful day.
Thanks, Michael, and all the best.